The eMEN project has the goal to promote and disseminate the idea and the products of e-mental health in Northwest Europe and maybe beyond. It's not enough to just introduce it in a clinic or in a praxis or wherever. It needs also the framework.
We all want to improve e-mental health services. We want people to get to know more about e-mental health, the possibilities, and we want to do this on several levels, the policy level, organizations, mental health care organizations, professionals, patients. So we all have the same goal, and that's nice to collaborate.
We've developed 7 products, 2 for depression, 2 for anxiety, and 3 for PTSD. And we have implemented 9 pilots. And we know that this project has already moved a lot of processes forward in an accelerated way.
In Ireland, e-mental health is relatively new, so it's very interesting to look at other countries like the Netherlands, for example, or the UK, where different e-mental health solutions have been already tested and implemented, some of them as in the mainstream mental health services.
We see the need to implement and to increase the use of e-mental health in France, being a latecomer in the field and also the country with the lowest use of e-mental health amongst the partner countries at the beginning of the eMEN project. But there is an exponentially growing interest in France on e-mental health, and eMEN can very much contribute to this development.
The reason I work with e-mental health is to give patients more control over therapy, so they get to work themselves on their own problems.
So we really hope that based on our studies and the results from the other partners, that we can guide institutions, that we can guide organizations, guide policy levels to help them in implementing e-mental health in their workings.